One question on the references that you were making. Like if you look at Quest, LabCorp, or any of these other companies, right? They have a different reference range.
Right.
So which one is it? Like which one do you base it off, right? And how are they basing these reference ranges?
Right. The reference ranges really come from studies that were done, usually in 2000, 2008, 2012, there was one study where as a population as a whole, people went and drew blood levels, and they took testosterone levels and they basically cut it off at 5% at the lower limit of normal and said, this is the lower limit of normal and this is the upper limit of normal. So, these reference numbers keep changing because every time you sample a random population, if that 5% number is 264, that's 264. If it's 349, it's 349. And whatever that lower limit of the normal is, that's how they're going to define their reference ranges. And so it's hard for us as practitioners to basically say, hey, make this as the lower limit of normal and so on. And patients get very confused because they get a 276 number, they think everything is normal and they don't need to discuss their problem at all. But if you get an 18-year-old with a 276 number and he thinks it comes back as normal, then now we're caught in a difficult situation because we know that 276 for the 18-year-old is not normal. Unfortunately, for testosterone levels, there's no age reference ranges.